So breastfeeding has a lot of benefits for mom and baby. Primarily for mom, it will be to just like the bonding with baby is the most important thing for parents. They really enjoy that like skin to skin and lots of time with mom. Another thing for mom that is a benefit of breastfeeding is it decreases the risk for ovarian and breast cancer when patients breastfeed. So super important for that as well. And then it also decreases postpartum depression as well for moms. So lots of benefits for moms for breastfeeding, as well as we kind of are aware of a lot of the benefits of breastfeeding for babies. So antibodies get transferred through the breast milk to the baby. So it helps with decreasing risk for viruses, bacteria, things like that. Really just helps the baby's like gut microbiome really just improve and make the baby super healthy. Breast milk is kind of just created just for that infant. So it has all the benefits that the baby needs. You created the perfect nutrient for your baby. So breast milk changes kind of and evolves as patients breastfeed. So typically those first few days we have just a little bit, couple mils of milk, and it increases to the ounces as the moms are breastfeeding. It can also decrease the risk for ear infections, respiratory infections, obesity later in life. So it has great benefits for baby as well. I just love being a part of like that journey for the mom and the baby. I used to be a postpartum nurse, kind of involved in all the postpartum mom and baby cares. And I just noticed that breastfeeding can be a challenge for a lot of patients and moms. So I like to be that person to help them, get them through that journey and help when the times are hard. Just kind of give them all the knowledge I can in education and help with positioning and things like that for breastfeeding.
Breastfeeding is just the best nutrition for baby. We make it, our breast milk is made specifically for our babies. So it's just the best way to feed our babies. In particular, we talk a lot about colostrum in the WIC program and how important that is to get the babies off to the right start. It's just packed in antibodies, essential nutrients, and then it also acts as just a natural laxative in those early days to get rid of the meconium that we're wanting to get out of the baby's system.
Typically, breast milk is made by supply and demand. So the more you pump or breastfeed, the more milk you're gonna make. So sometimes it's just reminding moms and parents that that's how milk is made. So usually we just need to increase the stimulation, whether that's pumping or breastfeeding, just kind of, that's the best way to start as far as to increase supply is just increasing the demand on the body. I would recommend them to come see us. We offer a lot of services here at Sanford especially and in the community, but I would recommend them to get a one-on-one appointment to either help with the latch, positioning, just education, telephone call, just learning what to do to improve their milk supply or improve their breastfeeding journey. Breastfeeding is challenging. It can be easy for some people, but that's not the normal, I would say. It's a labor of love and it takes a lot of work. So I think just keep going and seek out those resources and get people to help you if they can. Other moms are great resources. Lactation consultants are great resources, just kind of like how you can continue your journey and get the most education you can. The importance of breastfeeding maybe is well known, but sometimes when people meet challenges, it's easy to choose different options to feed your baby. And I think kind of like we discussed is just continuing on that journey. And combo feeding is great too. Any way to feed your baby is important, whether that's breastfeeding formula. You don't have to just latch your baby. You don't have to just pump. You can do breastfeeding and formula feeding. You can kind of do a combination of all the things. So I think just having that support and knowing that it's okay to do whatever you guys choose, and we can help you on that journey. A lot of women are nervous about breastfeeding when in public. We offer a lot of support and just reassurance. You typically formula feed your baby in public. You have a bottle and you feed your baby and nobody thinks twice about it. But then once a breast is involved and people are a little bit more concerned or nervous about breastfeeding, you can cover up if you want to, but we just support moms to feed their baby when they're hungry. And if people ask, just say, I'm feeding my child. So I just think it's really important to just like promote the positive things behind that. And we just offer a lot of resources. We have nursing covers to give away if people want, but we just really encourage moms to feed their babies however they're comfortable. super important when babies are separated from their parents right after birth to initiate breastfeeding or pumping or something of the sort, any stipulation within 1 hour of delivery. When babies are in our nursery here at Sanford, we offer breast pumps for parents to use in the mom's room as well as the nursery. So it's important to start pumping, and ideally every 2 to 3 hours to kind of establish that milk supply and get that milk to their babies. It's also important to know that when your baby is in the nursery, if you're separated a little bit after delivery, that your milk doesn't come in right away. It usually takes like 3 to 5 days for that milk to come in. So within 1 to 2 hours, we want to get you pumping. And then those first 1 to 2 days, it's just going to be mils, a few small increments of milk, but it's important to express as much as you can and kind of keep that stimulation going.
One of the biggest things that we do here at Public Health is we do have the Beltrami County Public Health Milk Depot. So really what that is it's an opportunity for moms who have extra breast milk that they would like to donate to moms in need. So we work with the Minnesota Milk Bank for Babies, which is down in Roseville, Minnesota, and we just offer a local drop-off spot for milk for the moms who have extra breast milk, just for convenience. And that milk goes to babies in the NICU and special care nursery just to help get that really important nutrition early on in their life.